Hi, my name is Amanda. I'm a PhD candidate in counseling psychology at McGill University and a doctoral psychology intern at the Emotional Health CBT clinic. Today, I'll be talking about panic and cognitive behavioral therapy. So, my talk is divided into two separate parts. And in this first part, I'll be talking about what a panic attack is, as well as panic disorder and agoraphobia, as well as the causes of panic disorder and some statistics on how common it is among the general population. Part two of my talk, which is going to be a separate video, is going to focus on treatment, specifically cognitive behavioral therapy. So, before going over what panic disorder is, we first need to talk about what a panic attack is. And it can include a variety of physical symptoms. And here is a list of most of those symptoms, but there's still some that are not included here. So, this is not an exhaustive list. And by definition, a panic attack includes four or more of the following symptoms. And this can include racing or pounding heart, sweating, trembling or shaking, shortness of breath, or feelings of choking, as well as chest pain or chest tightness. Also, feeling nauseous or having abdominal pain, dizziness and lightheadedness, chills or heat sensations, as well as numbness or tingling sensations along the body. And there's also more cognitive ones, such as a fear of dying or this fear of losing control. And typically, these symptoms increase in intensity very quickly and can last between 5 minutes to an hour, but that really varies as well. So, panic disorder is an anxiety disorder in which panic attacks happen out of the blue. So, there's not necessarily an obvious trigger for the panic attack. And so, because it can happen so out of the blue, and because a panic attack can be very intense and scary, the physical sensations that occur during the panic attack can become interpreted as dangerous and can trigger fear. So, this is why panic disorder is referred to as a fear of fear, because people develop a fear of the physical symptoms that make up our fear response. And so there's this fear of panic attacks that develops, and that can include worrying about when the next panic attack will occur, worrying about the consequences of panic attacks, such as losing control or this fear of dying. And then the physical sensations become interpreted as dangerous, and that triggers fear. So, what is our fear response? This is called the fight or flight response. And our bodies are designed to respond when a threat or danger is perceived in order to prepare our bodies to run away from, runaway flight or stay and fight. And this is an evolutionary adaptation to increase our chances of survival. So, for instance, if we're being chased by a predator, this would prepare our bodies to respond to that threat. So, these are some of the biological processes that take place when our sympathetic nervous system activates the fight or flight response. However, there's many, so this is just a few of them. So, for instance, we have an increase in our heart rate, which allows blood to pump throughout the body faster. And that's especially important if we need to run or if we need to stay and fight, as well as an increase in our rate of breathing, which allows our bodies to maintain oxygen and carbon dioxide levels. We are also going to begin to sweat, and that allows our body to keep cool while we're, running away from a threat or fighting. And then muscle tension, which prepares us to fight or flee as well. So essentially, this biological process is adaptive and important for our survival. We need this fight or flight response to survive. Um, we do not want to get rid of our body's ability to prepare us for danger. However, our sympathetic nervous system activates the fight or flight response even in situations in which we are anxious or afraid, but where there's no threat to our survival. And this could be called, this is thought of as a false alarm. So, in panic disorder, your body thinks that you may be in danger and is responding in that way in the absence of an actual danger. So, over time, this false alarm gets interpreted in such a way that the symptoms of fear are thought of as dangerous. So our fear response, the fight or flight response, is interpreted as dangerous. And in this way, a fear of future panic attacks and its symptoms can develop. So, what this means is that with panic disorder, catastrophic interpretations of the physical symptoms of our fear response are made. So, an example of this is interpreting, a racing heart or an increase in heart rate as an indication that one is going to have a heart attack. Another example of a catastrophic interpretation of the experience of the panic attack itself would be, for example, if I have a panic attack, I won't be able to cope. And so the symptoms of panic disorder often lead to changes in behavior to cope with and prevent panic attacks from occurring. And it's a very natural instinct to want to avoid things that we think are dangerous. And some of these avoidance strategies may include carrying around safety objects such as medication in case panic like symptoms arise, or you know, going out in public or in situations with someone that you feel safe with, so being accompanied with someone. Um, Also, avoiding activities that might trigger physical symptoms of arousal. So, for instance, avoiding doing exercise, which might increase one's heartbeat, avoiding caffeine and other substances that could trigger some of those physical symptoms as well as hypervigilance. So, what this means is checking one's physical sensations, like repeatedly checking one's pulse and taking one's blood pressure. And all of these coping strategies actually increase one's fear of panic attacks or panic and the physical symptoms of a panic attack. And in this way, it maintains that fear. But of course, our bodily functions fluctuate during the day naturally, as they should. But in panic disorder, these become interpreted as dangerous. So that brings us to agoraphobia. And the reason why I wanted to touch upon this is because many people with panic disorder develop some degree of agoraphobia. And agoraphobia is a fear of situations in which escape might be difficult or in which help might not be available in the event that a panic attack or experiencing panic like symptoms occurs. So, situations that can be avoided because of this fear can range, but some might include avoiding crowded places like malls or theaters, avoiding enclosed places in which escape um, might be difficult, like elevators, tunnels, airplanes. So, just to clarify, if we take the example of the airplane, it's not that there's a fear of flying in of itself, which would be more consistent with a phobia. But in agoraphobia, it's a fear of having the panic symptoms in the plane because escape or getting help in the event of a panic attack or those sensations might not be available. And so, with agoraphobia, there's a range of um, situations that someone might avoid, and that can range from a fear of panic symptoms on long flights, or not leaving one's home. So the agoraphobia might prevent someone from leaving their home um, because of a fear that in the event of a panic attack, they might not be able to get help. So, what causes panic disorder? Biologically, there seems to be a genetic component. And this is from research that has conducted studies with twins. So, for instance, it has been found that if one twin has panic disorder, the identical co twin is more likely to have panic disorder than a fraternal twin. So, this suggests that there is a genetic component, um, as well as other studies that have shown that first degree relatives are 8 times more likely to develop panic disorder than uh, to develop panic disorder if they have a relative um, who has panic disorder as well. And the psychological causes of panic disorder are believed to be those catastrophic interpretations that are attached to the physical sensations, which lead to panic and fear when the sensations are experienced. So, for instance, a racing heart or dizziness are interpreted as being dangerous. So while there seems to be a biological component, it doesn't necessarily explain it all, and there are other factors contributing to the development of panic disorder. So how common is panic disorder? Approximately 2 to 3% of adults and adolescents in the general population have a diagnosis of panic disorder in the previous 12 months. Whereas with panic attacks, it's significantly higher. So, approximately 22% of individuals in the general population have experienced a panic attack at some point in their life. And 50% of individuals with panic disorder experience other co occurring mental health challenges as well, such as other anxiety disorders. So, for example, agoraphobia, but also illness anxiety disorder, which is a somatic symptom disorder where someone has worries about acquiring a serious illness, as well as co occurring depression in some cases. And panic disorder can be associated with a high degree of functional impairment because people may begin to avoid doing social activities that they previously enjoyed in fear that they may experience a panic attack, for example, when in a public setting. And similarly, it can impair occupational functioning as well. And panic disorder is associated with a high number of hospital visits because the symptoms can be quite scary as they occur out of the blue. And sometimes people might think that their symptoms are indicative of a medical problem and will seek out medical help in those instances. So this concludes part one of my talk. As I mentioned, in part two, I'll be talking about the treatments for panic disorder. So thank you very much, and I hope you'll join me for part two.